Hey folks, I'm Casey Seiler. I'm the editor of the Times-Union. Thank you for joining us for the Rebound, Capital Region Attitudes Towards What Comes Next. It's about 2 minutes before 9 o'clock. We will start smartly at 9. So welcome to my attic, where I've been editor of the Times-Union for the last 2 months plus now, with the rotating fan over my head. It has become my Zoom background of choice, even though it's live. So it is a beautiful day in the capital region, albeit cold. Took the dog for a walk this morning. Very pleasant. Hoping that the gale force winds of the last couple of days have died down, and we can get down to some actual spring-like weather. So going to be talking to Don Levy of the Siena College Research Institute about a new Siena College Research Institute Times-Union poll that was conducted in the capital region. Very interesting results. And I'll say this again, but if you're on the call and you'd like to ask questions, please do zap them into us on the platform that you are watching this on. Well, it is 9 o'clock, so I guess we will begin in earnest. I'm Casey Seiler. I'm the editor of the Times-Union, and welcome to the Rebound, Capital Region Attitudes on What Comes Next. A programming note, if anybody has taken part in our Back to Business series of webinars, the final installment devoted to how businesses can prepare for sort of emerging from the coronavirus crisis will be held next Tuesday at 9 a.m. That will be devoted to ways in which businesses can and actually must reinvent themselves to deal with the current economic climate. If you go to Eventbrite, you can register for that discussion, which is free. If you want to watch the previous 3 installments of our Back to Business series, those are all available on timesunion.com, as well as on our Facebook page, where some of you might be watching this event today. So with that, let's begin the discussion. I am happy to be joined by Don Levy, Director of the Siena College Research Institute. Don, how are you doing today?
Fantastic. Wonderful to be with you, Casey.
Good. So if you could tell us a little bit about the scope of this poll and how it was conducted. The crisis, the healthcare crisis, has been so kind of fluid. When was this capital region survey conducted, and how did it sort of define the capital region?
Sure. We took a look at 11 counties of the greater capital region. So it's Albany, Schenectady, Rensselaer. We went a little bit north, Saratoga, Washington, Warren. We included Columbia Green, and then out to the west a little bit with Fulton, Montgomery, and Schoharie. So those are the 11 counties that we took a look at. And the poll was conducted. We interviewed just over 1,000 residents of those communities between the 27th of April and the 1st of May. So it's pretty hot off the presses. And what we were looking at was exactly how people feel about going back to work, reintegrating into society. So that was the intent of the poll.
And it's worth noting that it might not be exact, but I think the 11 counties that you just defined comprise the Regional Economic Development Zone, which is sort of the unit by which state government and the Cuomo administration is considering allowing regions to reopen again. In other words, it's not county by county. They're really trying to do it by regional economic zone.
Absolutely, Casey.
Yeah. So you mentioned it, but let's dig into what people I think would consider to be some of the most interesting numbers in the survey. Its assessment of how confident folks in the capital region are that they'll be able to return to work with safety.
Absolutely. We asked a couple of questions. about how confident people are that the businesses that they frequent in their community will do everything it takes to keep they as clients, they as customers, and they as employees safe upon going back to work. We saw a little bit of a difference. 27% feel very confident that the businesses in their community, so everyone that they frequent, will do everything it takes. About half feel somewhat confident. And I think the distinction between very and somewhat is important here as we continue this discussion, because safety is so critical to everybody in the capital region. But then we asked a second question. We said, well, what about your business? So of the people who were employed outside the home prior to the crisis, then we said, okay, we're not asking about your local grocery store or your local retailer. We're asking about your business, where you work. And there we saw a little bit greater percentage. Just over half of people that we spoke to said that they were very confident that their business will do everything it takes to keep them safe. So it was really, I think, a striking difference there. People are a little bit unsure. They're hopeful. They believe they're somewhat confident that the business in their community will do everything it takes. But over half of them say that they're confident that their business will do everything it takes.
The poll asked a series of questions about what would make people feel more comfortable about returning to work, whether it's sort of measures that employers could take or things that are really out of businesses' control in terms of a vaccine, or things that are sort of more on states and even the federal government to address. If you could kind of take us through that list, and you ranked them once the results were in, that kind of went from things that would make people feel most comfortable down to, maybe not quite as important to folks as they contemplated going back to the office.
Well, absolutely. I think this is a very striking part of the poll. And we asked about 10 different things that either the employer could do themselves, or people feel the community needs to do. At this point, it seems as though it's an extremely high bar. In order for people to feel completely safe, it's going to be very, very difficult. So let me read you first the 10 items, and I'll read them in rank order of how necessary folks said they are in order for them to feel safe. One is that they will be provided masks at their place of employment. 3/4 of people said that's absolutely necessary. Then we go to one that's outside of the employer's control, that being that there is a treatment in place. So think about it, 71% of the respondents said that's necessary to me before I will feel safe going back to work. It doesn't look like there's any chance that we're going to have a treatment in place, certainly within the next month. Then the next one was that the workplace be professionally sanitized each and every day. Again, nearly 3/4 asked for that. So those were the top three. Moving to the next tier, nearly 2/3 said that in order to feel safe, I'd like to see widespread diagnostic testing. Another, just one peg down the list, is antibody testing. And also over 60% say it's absolutely necessary that the workplace be reconfigured to accommodate social distancing. So you think about if it's a manufacturing facility, if it's an office facility, that desks are moved, machines are moved, that the number of people that are in the workplace are altered so that social distancing can take place. And again, think about it, 61% said that's absolutely necessary. And then the third tier, if you will, but all of these had over 50% saying this is absolutely necessary, is that contact tracing, effective contact tracing, is in place. So that being when someone tests positive, that the folks are in place to go ahead and trace back that how they got the disease and who they've been in contact with. 53% say they won't feel safe until there's a vaccine. And most of the commentary, of course, relative to a vaccine is that we're looking at perhaps a year out on the vaccine. 57% thought we should keep anyone who can work from home, whether it's in their attic or their dining room, at home. And then again, a majority, 55%, said that we need to have the employer handing out protective equipment, whether it be gowns, face masks, all the personal protective equipment. So when you add all those 10 together, it's an extremely high bar. And I know you're going to ask more about it. I'm interested to hear your opinion on it. But what it says is that in order for us to go back to work, all 10 of these are not going to be met anytime soon. We're going to have to absorb some risk, is what people are telling us.
But that's remarkable that those are all majorities for that it would be either necessary or very important. Is that's correct? That's the proper way to read the data?
It's even more demanding than that. The choices we gave for each of those 10 were, is this necessary for you to go back to work? Or is it something you would like, but it's not completely necessary? Or is it not at all important to you? And so these numbers that I'm reading you are all the people who said, this is absolutely necessary to me. In fact, 1 out of 8 people, 12%, said every single one of those is absolutely necessary to me before I go to work. And over 2/3 said that most of them are absolutely necessary before I feel safe.
I just want to pause here to remind folks that if they have questions about any of the responses, the data that we're talking about, we're going to be addressing questions in sort of the final act of this program. And please, if you're on Facebook or on YouTube, please post your questions down there. Our outstanding multimedia producer, Jess Marshall, is going to be, will be kind of collecting those and sliding them my way later in the discussion. So what, Don Levy, are people thinking about when the question comes to when the New York pause, what can be broadly described as the state shutdown, when the pause will end in their county?
Let me pause for 1 second before I jump into that question and introduce just a concept that I think is important. It's on a lot of people's minds. That being that we saw a pretty interesting variation between people who identified as being Republicans and people who identified as being Democrats on many of these questions. So even some of these items that we just talked about that folks in the greater capital region say are necessary, we saw an ideological difference on some of those responses. So for example, when it came to the workplace being professionally sanitized, that number was at 78%, nearly universal amongst Democrats, but about 14 points lower, 64% amongst Republicans. We saw similar kinds of differences. Not that Republicans were saying, I'm ready to go out right now and feel safe, but there was a decided difference. So, that comes up even more so now when we talk about attitudes towards the on pause. Now, we asked this question, I thought, really very fairly and very softly. We gave people 2 choices, and we introduced the on pause, and we said, which of these 2 positions is yours? Do you think that it would be safe on May 15th to gradually end restrictions and begin reopening the economy? So it wasn't just throw the doors open and do whatever you want. It was either gradually end restrictions and begin reopening, or keep the restrictions in place beyond the middle of May as they are. And there we saw that relative to the state of New York, 49%, nearly half, say we need to keep the restrictions in place as they are. 39% said, I think the state can gradually reopen. Now, we were interested to see whether it would be different when we said, well, what about your county? It was, but a little bit. 48%, so nearly as many, say we should keep the restrictions in place as they are. Slightly more, 42%, said, I believe it's safe to gradually reopen. Now, this is where the difference between how Republicans feel and Democrats feel is striking. A decided majority of Republicans, well over 50%, say, I think that we can gradually reopen. It's time to begin opening the doors right now. Conversely, a very large majority of Democrats prefer right now to keep the restrictions as they are in place beyond May the 15th. So this issue of opening, this issue of ending or continuing or adjusting the on pause takes on a decided ideological view.
You mentioned, of course, and thanks for bringing that up, and that's a theme we'll probably be returning to as we go through more of the data. As there are partisan differences that are often very chewy and interesting for expert pollsters like yourself to look at, there are, of course, also often, not always, gender differences on these types of questions. Is that borne out in the questions that you were just discussing as well?
Absolutely. When we break this down by gender, we see that a decided majority of women say, I think we should keep the restrictions in place as they are. So there's a reluctance on the part of a majority of women to say it's time to gradually reopen. Flip that over, a plurality, it's not quite a majority of men, but it's a plurality of men say, no, I think it's time to gradually reopen. So it does appear, and you could argue that men perhaps are more willing to accept a certain level of risk right now, because certainly the men that we interviewed again and again and again told us that they needed masks, they wanted a treatment in place, but they're willing more so than women to accept that risk and to gradually reopen businesses across the state and within their county.
Another notable part of the poll assesses respondents' attitudes towards what the landscape is going to look like several months out, be it business or sort of the social landscape, community, family events, that type of thing.
Well, this is a really striking and interesting part of the poll, and let's go through it kind of slowly because we asked quite a few questions about this. The first one I want to talk about is we asked people to think about their workplace in September. So again, now this is of people who were working outside the home before the pandemic started, and we gave them three choices. Do you think things are going to be back to normal in September? Or do you think that things are going to be a little different and social distancing will be practiced, people might be wearing masks, that it will be different? Or do you think it's going to be completely different and that every business place will be overwhelmingly engaged with how can I keep people safe? Again, we see an ideological difference, but let me give you the numbers off the top. About 19% of folks in these 11 counties said, I think September is going to be back to normal. So 1 out of 5 think it's going to be back to normal. Relatively small number. Over half, 52% said it's going to be different. We're going to be wearing masks. We're going to be practicing social distancing. So this is now a poll taken, let's call it May 1, projecting what they believe the workplace is going to look like 4 months in the future, after the entire summer. And another quarter said, I think it's going to be completely different. So if you add the two differences together, you've got 3/4 of people who were working outside the home before the pandemic who say, by September, workplace is going to be different. Then we asked them the same three choices, Casey, a year out. What about a year from today, 12 months? Surely by that point, things are going to be different, right? And we did see a change, 41%. So from 19 to 41, so that number about doubles. Say, yeah. In a year, things are going to be back to normal. But still, 40% say in a year from today, so May of 2021, we will be practicing social distancing. We will be wearing masks in the workplace. And we're down to 10% who think things are going to be different. Again, Republicans and Democrats see this differently. Republicans are far more likely, although not overwhelmingly, 27% of Republicans think that things will be back to normal in September, but 51% of Republicans think that things will be back to normal a year from today. I'll pause for a second to see if you want to react to that before I go into that other list of questions.
Well, maybe to pause, and forgive me for kind of asking a bit of a change-up question, but the 11 county capital region zone that this poll covered, it's worth noting, isn't it, that this covers a lot of demographic as well as geographic territory, that you've got everything from, as you noted, Schoharie and Warren County that are far, far more rural, as well as, what are kind of the urban core counties of the region, Saratoga, Schenectady, Rensselaer, and what's the last one? Saratoga, Schenectady, Rensselaer, and Albany, the kind of four core counties. So you're covering a wide demographic swath, politically, economically, in a lot of ways. Is that fair to say?
Yeah, absolutely, absolutely. And I think that we didn't see as much county by county variation as we did in some of the categories that we've been talking about in terms of gender, age. We haven't really talked about age much. Certainly amongst the younger respondents, there was a more of a willingness to accept risk and more of a sense of predicting that things will return to normal, as opposed to older New Yorkers who tend to be a little bit more risk averse. We'll see that a little bit more when we look at some of the behaviors that people are experiencing and are engaged in. So some young old variation. And then the most striking tends to be this party variation, that people see to some extent some aspects of this crisis through their ideological lens, perhaps based on who they trust more, who they listen to more. In some of our other polls that you're very familiar with, we continue to ask about how good of a job the president is doing, how good a job the governor is doing handling the crisis. And we see that while the governor continues to have very, very high ratings of approval, as much as 80%, the president has about 45% approval here in the state of New York. So we see a difference. And I'll tell you anecdotally, and we get these messages all the time at the Siena College Research Institute, where someone will send us an email. They'll see, most specifically recently with Governor Cuomo's high approval ratings, and someone will send me an email saying, I don't know who you're polling. Everybody that I hang around with thinks he's doing a terrible job.
I think that's called self-selecting your sample.
Yes. But clearly, when we say that the governor has an 80% approval, there's a few who say don't know, but there's 10 or 15% out there. And the folks who send me those emails are included in those numbers.
And it's worth noting, I was talking to Steve Greenberg, I think it was about perhaps two and a half weeks ago, when Siena put out their statewide poll that had those very good approval ratings for the governor's performance. And he noted that they appeared to be the highest rankings for a governor since Siena began conducting these polls, sort of, I think, right before Eliot Spitzer took office, which is pretty remarkable.
It is. And I think that now we're seeing, this morning I was looking at some of the approval ratings for governors across the country. And there are quite a few governors, Governor DeWine in Ohio, Governor Northam in Virginia, who are getting extremely high ratings, getting the highest of their tenure as well. So there are any number of governors who are seen by the people of their state as leading effectively. Certainly that's true of Governor Cuomo here in New York. The president is not getting those kind of numbers either nationally or here in New York. So depending on your party affiliation, of the 44% who feel as though the president is doing a very good job, they certainly might see some of these aspects that we're talking about of confidence in returning to work, or other aspects of this poll that could be interpreted ideologically. They may be amongst those who are more likely to say, let's open up the economy.
But to bring it back round again to the Capital Region survey, did you want to talk a little bit more about what the results tell us about what folks think the landscape's going to look like a couple of months out?
thank you for bringing us back on task.
Oh, no, I derailed us. It's absolutely not your fault.
We asked a series of questions asking people how likely any number of different events are. And these are the events that every single one of us is talking about. So let me run through a couple of them. And I invite people to think about this, because some of them are going to seem a little bit contradictory. And Casey and I had a chance to talk about this. But for example, we asked, how likely do you think it is that COVID-19 will continue to spread this summer? A concern that all of us have. And there we found that 75% think it's at least somewhat likely that it's going to continue to spread, that we're going to continue to hear about new cases this summer. At the same time, amongst the same people, obviously, we asked, do you think that by July, upstate New Yorkers are going to gather together with family and friends without the need for social distancing? And there we found that 60% said, yeah, I think that's somewhat likely. So, that's one example where simultaneously a decided majority think it's likely that the disease will spread, the virus will spread, but that people will be gathering for barbecues, picnics, outings with family and friends. So there's this mix of realism, hope, that cross each other. Another one that we saw the same kind of relationship was when you look to the fall. And there, a disturbingly high number, 74%, 3/4, think that it's at least somewhat likely that we're going to see a large outbreak of COVID-19 in the fall. So something that, clearly there's been a lot of coverage. This has happened with other, flu-like events, but 3/4 think we're going to see this outbreak in the fall. Yet, more than that, 83% think, well, schools are going to open. I think it's likely that we're going to open up our schools here in the greater capital region in the fall. And 85% think it's somewhat likely that we're going to see a gradual and successful reopening of businesses across upstate. So we hold these two views, as a collective group of people here in the capital region simultaneously. We think it likely, we're afraid, but we think it likely that the disease is going to continue to spread. Yet we think we're going to hang out with our family and friends. We're going to open up schools and businesses will successfully open.
So speaking as an English major, was it F. Scott Fitzgerald who said that genius is being able to hold two completely oppositional ideas in your head at the same time? And that seems to be very much in the American grain, based at least on the results of this capital region poll.
Absolutely, and I think I invite everyone who's listening in to think of their own view. And maybe at 9 o'clock in the morning you're worried about the disease spreading, and by 2 o'clock in the afternoon, when the sun is out and it's beautiful, you say, yeah, I think it's likely that we're going to gather as friends and family. So we do hold those two, but it's this difficult. It's a really kind of a description of this difficult emotional, psychological environment that we live in. Another point I'd like to make before we move on is another thing that we asked about was about returning to your business. And we asked people, how likely do you think it is that the business at which you were working prior to the pandemic will survive this crisis? Crucial question for business owners, employees. And we found that just over half, 52%, think it's very likely that their business will survive. And again, that's one of those numbers that's in the eye of the beholder. It's a majority. Is that a good number? 18% think it's somewhat likely. There's certainly a rate of confidence amongst a majority of New Yorkers, but it's not universal. So there's a sense that some businesses may very well not be able to survive this pandemic.
Don Levy of the Siena College Research Institute. It's fascinating to hear this, and I just want to remind folks that if they have any questions, we're going to be dealing with them later on in the discussion. Please post them on the Facebook Live page or on YouTube, depending upon how you're watching this. This poll, the Times Union Siena College Research Institute poll, asked respondents to list some of the ways in which the crisis has directly affected them. And here, these questions kind of overlapped with the larger statewide poll that I just referred to, that had come out perhaps 2.5 weeks earlier, that showed strikingly, as this poll did as well, just how much the COVID-19 has kind of swept through and affected people on a very personal level.
Yeah, absolutely. I mean, we certainly asked, as we have in many of the polls we've been doing since the pandemic, about your level of concern. How concerned are you that someone in your family is going to get sick? How concerned are you that your finances are going to suffer to the point where your quality of life is going to suffer? And we saw dramatically high percentages of New Yorkers, of course, who are concerned about the illness, but also who are concerned about damage to their finances. Staying on finances for a couple seconds, perhaps good news is that 54%, over half of the respondents, told us that they have already received money from the federal government stimulus program. So just over half, almost 2/3 of younger residents. Interestingly, nearly half of Capital Region residents with an income of $100,000 a year or more have received federal stimulus money. But more specifically, in terms of how it's affecting your ability to survive financially, disturbing number, I think, is 26% of all respondents say that somebody in their household has already been laid off. Those numbers go up amongst younger respondents, people who do not have a college education, or those making under $50,000 a year. So layoffs are taking place and are very real. Nearly half say they already are having trouble with obtaining groceries, paying for their incidental, their regular monthly expenses. We see 24% already who are saying that they've applied for unemployment benefits. So the economic effect is very real. Sometimes it feels, so many of us, of course, are sheltering at home, are not interacting with the world as we did in February of this year. So we don't know. But while the economic impacts, the percentages of people who have been laid off may not be as high as in some other areas, with 1/4 of Capital Region residents saying a member of their household has been laid off, it's striking. And of course, we also asked about whether you have, whether you know someone who has passed away due to the illness. And that number is high, 21%, 1 out of 5 residents of the Capital Region know someone who has died due to the coronavirus.
The poll also asked people to say what measures they are following personally themselves to fight the spread of COVID-19. And there, it seemed like the response was hopeful, in the sense that a vast number of people are doing their best to kind of follow the best guidance from the CDC.
Yeah, absolutely. This is one that we're certainly interested in tracking this as we move forward. We asked about 4 different CDC recommendations and or mandates: wearing a mask when out in public, social distancing, washing your hands more than normal to try to control the disease, and then also sheltering at home. We found that 80% of people said that when they go out in public, it's completely true that they are wearing a mask. So 8 out of 10 say that they are fully adhering to that. And again, I asked people that are listening in to compare that to your experience. So that seemed to be across the board. In terms of social distancing, we see a little bit of difference by age. Overall, nearly 2/3 of us say that we are practicing social distancing. That's much, much higher amongst New Yorkers who are age 65 and older. Of young New Yorkers, 18 to 34, only half say that they are completely practicing social distancing. Washing hands, very high rate. But the one I wanted to mention for a second was sheltering at home. That's one that may very well start to change more and more as the weather continues to improve. Currently, 38%, about 4 out of 10, say that they are sheltering at home, and they say that's completely their behavior. 53%, a majority, say I'm sheltering at home as much as I can. So they're starting to go out. That may very well for some people just be a trip to the grocery store, a walk in the park, taking the dogs for a run. But the sheltering at home, as far as it being complete, is at 38%. My belief is that was higher in, say April 1. And my expectation is that the percent saying they're completely sheltering at home as we move into the summer will be a little bit less.
You also asked what would make people safe about going outside, and it seems strange to even ask that question, but of course, just the act of going outside, whether to throw another bottle in the recycling bin or whatever, these days seems to be kind of fraught with a certain degree of peril sometimes.
Yeah, absolutely. Just to get inside the weeds of the poll a little bit, as I mentioned, we talked a little bit over 1,000 residents of the greater capital region. Of those, 61%, or about 600, were people who identified as having been working outside the home prior to the pandemic. So the last time we talked about the conditions that would make you safe, it was of those. Now we're asked 100% of the people we talked to, what's going to make you feel safe going outside your home, going about your normal routine. And again, we saw a similar kind of response. This one, the number one thing that would make all the capital region residents feel safe going outside is if there was an effective treatment in place. 3/4, 74% said that's absolutely necessary before I'll feel safe. You would hear a deafening collective sigh of relief if the headlines on the TU read "treatment found." We all look forward to the day where the font is enormous and that headline is there, because that's the one that would make people feel the safest. That's followed by widespread diagnostic testing. We've all heard the debate over testing. But people have heard that and listened, and they say that would make me feel safe. And then a vaccine. 61% say I won't feel safe until there's a vaccine. Lesser response to social distancing, the wearing of masks, contact tracing, but still very high. Over 50% for each of those say that that's necessary for me to feel safe. So again, despite the fact that a large majority of capital region residents believe that it's likely that we're going to be having summer barbecues without social distancing, they've already told us here that they're not necessarily going to feel safe until there's all these conditions being met.
And that's significant, as even though the weather remains kind of blustery here, we're coming up on sort of the start of a lot of summer activities. We've got stories in the paper and online today about drive-in theaters that are ready to open up here in the capital region this weekend. We're coming up on Memorial Day, which is sort of the unofficial start of cookout season. So a lot of these questions will become far less academic in the weeks ahead.
Yeah, absolutely. I think, as you know, I'm a sociologist by training, so I'm interested in social interaction. And we're going to see some really interesting events take place where the normative behavior is not necessarily clear. Do you tell someone to back away from you if they're getting too close to you or not? How are you going to respond to someone who is all of a sudden standing next to you and is not wearing a mask? So we're all going to have to make decisions. We've already found out that large majorities say, I don't feel safe unless, we go down the list, masks, social distancing, et cetera. So what do you do if someone says, I'm okay, I don't have it, and they happen to be next to you? We're all going to have to address those questions in the world at large. And then, of course, when we bring it back to the idea of going back to work, every one of our workplaces is going to have to deal with that too. I mean, we have a call center. We have a relatively small space at the Siena College Research Institute where we, on a good evening, we've got 65 people in a call center, and they're 30 inches from one another. We know that we're not going to open that call center back up. We're working entirely remotely now until we reconfigure it to allow for social distancing.
Yeah, I mean, the Times Union newsroom is similar in its in kind of its configuration. And as we contemplate, and there's kind of no timeline for when reporters and our layout staff and everybody else might come back to the newsroom, the thing I always come back around to, and I've mentioned this before on a couple of Zoom webinars, what's it going to be like to be in the newsroom the first time that somebody sneezes, and at 10:30 in the morning on your average Tuesday or Wednesday. People sneeze maybe every 10 minutes or so, but I would imagine that it's going to, at least that a kind of initial sneeze is going to have the effect almost of a pistol shot. So
yes.
Well, actually, that's a good segue to my next question. About kind of what might be called polling in the time of coronavirus. You might not be able to say this sort of definitively or scientifically, but your gut in this case will be just fine. Do you get the sense that people who are staying at home, who are on lockdown, are more open or even perhaps appreciative about interacting with pollsters? That it's another human voice. It's something to kind of keep you busy.
We've definitely seen that, Casey. It really is. It's an unfortunate event, obviously, but polling has actually benefited. When the pandemic hit and we closed down our call center, it took us a little while to get up and running remotely, so that the interviewers who used to come and sit in our call center are all working from their attics and kitchen tables. But we have found that both in terms of our production, how many interviews per hour do we complete? How many people are willing to be on the phone with pollsters with us? Those are up in some cases 25%, in some cases 30%. We're doing a project right now that's one that is very similar to one that we did the exact same project 3 years ago. And our production is up on that same project, same region that we're calling to, by about 30%. And then anecdotally, some of our interviewers are telling us, as you alluded to, that the interviews themselves are longer because people want to talk. They not only say, yes, I'll do your poll, but they start interjecting aspects of their life, how the questions affect them, and they want to talk. So it is an odd boon to pollsters that for this very brief period of time, perhaps, we've seen our productivity rates go up really quite dramatically. And this is after several years of seeing difficulty with polling, because so many people had gotten to the point, we're long past, whether it's land or cell, because most of the calls we make are via cell. But it had gotten to the point where people said, I don't pick up the phone unless it's a number I know. Well, currently, many, many more people are saying, somebody's calling me. I'll talk to them. So it's a interesting and for us beneficial development.
Pollsters, like journalists, do not want to become part of the story. But if a pollster had called me up a couple of weeks ago and said, do you know anybody who has been diagnosed with COVID-19? I would be able to say yes, because I know you and your wife were both diagnosed. I think you were I think it's fair to say in sort of the first wave of cases that were diagnosed in the capital region. Talk a little bit about that experience, if you don't mind, and what would you say to people who are living with anxiety, whether mild or extreme, about potentially coming down with the illness or having their loved ones or family members go through it?
Well, sure. I mean, I got sick the very first week of March at a time, if you look back on the history of this illness, that it wasn't completely clear what it was. It was hard to diagnose. In fact, when I got sick and started feeling very bad, the classic COVID symptoms on March 3rd, and got a hold of my doctor, got a hold of a pulmonologist because I'd had some pneumonia earlier in the winter. And they said, oh, just do what your grandmother would have told you to do. Have some chicken soup. And so that there wasn't even an awareness. But 1 week later, around the 10th of March, that's when everybody started to realize what was going on. Ultimately, I was tested at Albany Med about an hour and a half after they got their exterior tent set up to start testing. And because I had had pneumonia earlier in the winter, they put me in the emergency room, did a CT scan. And when the doctor came back in wearing full hazmat gear, which was a little bit frightening, and said, the pattern in your lungs looks like shattered glass. You have all the classic symptoms that we're hearing about with COVID. Then I was inpatient for 4 days. And fortunately, my oxygen never got so low that there was any threat of needing a ventilator. But I was sick. I was concerned. I was a little frightened. And when they finally did say yes, the test came back positive. Maybe I'm an optimist. Maybe I'm kind of an idiot. I don't know. But I still was surprised, even though it was clear at that point. I was fortunate. I had given the disease apparently to my wife. She was about a week behind me. I was released from the hospital, spent 2 weeks on the mandatory quarantine, and every day started to feel better. So, I think the message is that, most people, if you're healthy, can survive this. Certainly, I have 2 teenage grandchildren who live with us, never showed symptom 1. So there are clearly people who can be exposed and have no symptoms, and certainly can work your way through this virus, this disease. But it is indeed frightening, and certainly I experienced that. I felt a little, of course, guilty as well, because obviously I'd had it for a number of days. I was going to work, no doubt sneezing, and the health department did try to do some contact tracing, got a hold of the folks that I directly work with, the doctor's office that I had been to. But there were probably a few gaps in the contact tracing as well. My belief is that I got the virus on a trip to New York City on a speaking engagement the week prior to me feeling sick. And they never really did try to run those people down. So contact tracing is crucial. I think we need that. The testing is crucial. But I think that folks can survive it. And when I first got it, my wife and I, we wanted to go public because at that point in time, if you remember, in about the middle of March, there was some underlying concern that if you got COVID, it was a death sentence. So clearly it's not. But I certainly don't wish it upon anyone either.
Yeah, you spoke to our columnist Chris Churchill for a very good piece, and I know a lot of people who read that and were comforted by it, while at the same time, of course, being concerned for you and your wife. So, needless to say, very, very glad that you made it through, and it never got exceedingly dire. So with that, we just have a couple of questions from the audience, but if anybody out there does have a question for Don Levy about anything that we've discussed, please feel free to post them on Facebook, on this page, and YouTube as well. So here's one question posted by Darlene. Why not include Saratoga, Albany, Schenectady, and Rensselaer counties as one region, since public transportation goes to those counties?
Certainly a good question. Whenever you do a poll, you have to make some decisions. And I would say that insofar as in doing the poll, we had a representative sample, the larger share of the population in the poll was from the more populous counties, which obviously would be the counties that Darlene just mentioned. We didn't ask specifically about public transportation. Certainly that's something that we may very well take a look at in the future, because really every aspect of life, every workplace, every aspect of people's experience is going to be affected. Not only am I interested in public transportation, but I'm also interested, for example, in grocery store behavior. We talked about that really quite briefly. That's something that I think, provisioning is something that everyone's going to deal with. So we may very well ask about some of those difficult normative moments that take place in the grocery store. But we post all of our data. I think it's available both on the Times Union website. It's on our website. So if you do want to look at the minutia of the data, it's available there. And we're always available. If anyone has any questions, they can reach us directly, and we're happy to query the data. For example, someone may say, well, what about just respondents from Saratoga, for example? If you call us at the Research Institute, we can break out that level of detail for you in a poll.
Yeah, thank you for pointing out. Steve Hughes, who is our Albany County reporter, did 2 excellent stories that appeared in print on Sunday and Monday, and of course they're available online right now, digging into the details of this poll. And as Don noted, the crosstabs are available in those stories if you want to do more research on this. Question from Ronald on Facebook, who asks, do you think that with reopening New York, people will be less likely to practice careful behavior? And that's asking you to be a bit of a prognosticator, but I assume that very question, as you noted, is something that the Siena Research Institute is going to be looking into in polls, not just weeks from now, but months from now, and probably for a very long time.
Yeah, I think that my guess on that is certainly no better than anybody else's who goes out in the world. I mean, the poll reads to me that people are very much concerned about their safety. Some people are more willing to take risks than others. Certainly, the poll indicates that currently on social distancing, younger people 18 to 34, already are practicing social distancing at a rate far lower than older New Yorkers. So you can conclude from that quite possibly, as things open up, the people who are least risk averse will be more likely to lessen their social distancing. But to Casey's point, we will continue to poll the politics of COVID-19, the social aspects, the economic aspects on a regular and ongoing basis, because it affects every single aspect of our lives here in the capital region, New York, and of course, the country and the world.
A question from Steve posting on Facebook. I wonder how people are defining workplaces being completely different and being somewhat different.
Right. We tried to give them a sense of that. And the question actually was a bit of a long description. So we said to them, somewhat different read as, I'm moving quickly here, it will be different. Social distancing will be practiced, the space may be redesigned, and personal protection will probably be worn. That was somewhat different. Completely different was, it will be completely different. If the business is open at all, many people will be working remotely, and every aspect of the business will continue to be affected by protecting employees, clients, and customers from the virus. So that's how we defined it. And we tried to give people a sense of what somewhat different was, that there will be restrictions, there will be efforts, versus completely different. And we indicated that maybe completely different meant that the business wouldn't even be open at all. So that was how we sought to define that. But thank you very much for that question.
Don, I think that's it. We have just run through all of our questions, and I've run through all of mine as well. So thanks very much. I mean, the ability to look at this kind of mound of data, make sense of it, and sort of parse it out is a real skill that I know you've devoted your life to, and I really appreciate your taking the time to dig into these very important issues with us. So Don Levy, Director of the Siena College Research Institute. Thanks very much for spending the time with us.
Absolutely. Thank you for putting it together. It's always great to work with you, Casey. Look forward to many more of these in the future.
Cool. And with that in mind, a final programming note. Many of the issues that we've discussed in terms of folks returning to work are being dealt with in our Back to Business webinar series. We have 3 of those under our belt. You can watch those on timesunion.com and on our Facebook Live page. The 4th and final edition of that webinar, which we're producing in association with Hugh Johnson Advisors, happens at 9 a.m. on Tuesday. The subject is going to be ways in which businesses can reimagine themselves to address the new economic landscape. If you go to Eventbrite and do a search for Times Union or Back to Business, you can register for that free event. But you should also simply feel free to check in on our YouTube page or Facebook at 9 a.m. next Tuesday. So thank you very much for taking part in this session. I hope it gave you some context on what the Capital Region, the greater Capital Region, is going through right now. And I hope everybody stays safe and has a terrific day. I'm Casey Seiler, editor of the Times Union, wishing you all the best.